We have just so many different types of groups represented here, from the local district-based community organizations to some of the larger provider organizations and patient groups. And welcome.
Thank you.
This is kind of like the showcase showdown of The Price is Right. You know, we just kind of keep things moving. Yeah, right. So using this, tell everybody who you are and where you're from.
Thanks. I'm Tricia Pierce. I'm from two places, actually, Birmingham, Alabama, and New Orleans, Louisiana. I'm sort of straddling two jobs right now at the universities there. And I'm here actually representing the American Academy of Nurse Practitioners, which is a member-driven organization for nurse practitioners in this country. We represent about 130,000
Holy
nurse
moly.
practitioners. Yeah.
And what's so important is the role that nurse practitioners are playing today as a healthcare provider. Take just a second to explain to everybody why these are the most important people on the front line.
Well, nurse practitioners work in a number of different venues, you know, acute care hospitals, outpatient primary care settings. We work with all age spans, from babies, children, pregnancy through womb through the tomb, essentially, pregnancy through death. We focus on our patients' care in a number of different ways, but we're primary care practitioners in a large sense.
Now, you came here, Patricia, from Birmingham.
Yes.
First of all, your trip in okay?
Trip was great.
Okay,
yeah.
good. That's always, you know,
yeah.
It's 50-50 these days.
Yeah.
But more importantly, what brought you here? What was the impetus?
What brought me here was, well, the conference was a huge draw. I was not aware of the conference. It was brought to my attention just a few days ago, and I said, I have to be at this conference. I think eAdvocacy is just a critical factor in everything that we do. Nurse practitioners work on behalf of their patients. We take issues, you know, to the Hill every day. We are generally very active in legislative issues, but it's not just that. It's communicating with our constituency, and with the rising use of social media, you just have to be there, and you have to understand how to use these tools well in order to get your message across. I just went to a presentation that talked about, you know, the right message, the right time, and I'm thinking, it sounds like nursing, the right drug, the right time, the right dose. You know, how do you determine all those things? And we have to know how to do that in order to be very effectual in what we're doing.
It's wonderful. And in terms of what you've seen already, expectations met?
Overmet. I walked in this morning and I thought, well, I've never been here before. This will be a first time. There's, you know, whatever I go to, there's always a pearl to take home. And the pearls just was like a huge pearl necklace that was 6 feet long, just broke and scattered all over the room.
Oh, that's sweet.
So, yeah, so lots of pearls to take home.
Very important question.
Yes.
Alabama or Auburn fan?
You know, I came to Alabama from a circuitous route of New Orleans, North Carolina, Salt Lake City to Birmingham. In Alabama, you're either Auburn or you're Alabama. But when you come there from somewhere else, it's like, I don't care who wins. I just want an Alabama team to win.
Right.
So yeah, I can't
Hey,
do
good for you.
Yeah, I'm a Saints fan. So
Fair weather.
Yeah. I'll go with the Nationals.
That's wonderful.
Yeah.
That's wonderful. I just figured we'd ask. The University of Alabama, where you're based out of, leader in teaching and producing the front line of,
you know,
providers.
the whole bit, and they're very much into you know, looking at how we can use these tools to more effectively do what we do. I teach online, so I'm maximizing the tools for teaching distance accessible courses. But we're using these tools with our patients in our setting, in our, you know, work with each other, and so. But we're not maximizing them.
No.
And that's what I think this conference can really help people to do. You know, it's like any software. If you don't maximize it, you know, there's not much sense in using it.
Right.
So we have to figure out exactly how to make those things happen.
Right, and then we could talk all day, and you know, they're going to eventually give us the high sign. But and you have to. By the way, the food downstairs is phenomenal. So every moment we talk is a moment you're not eating.
Thank
so
you for doing this.
2
meeting.
seconds.
It's awesome.
Tell me, you're welcome. Tell me, policy-wise, you know, the American Academy of Nurse Practitioners. Obviously, you have a lot of issues, and there are a lot of things that I'm sure you're monitoring from health reform, you know, from that perspective. But and I don't mean to put you on the spot, and you know, for lack of a better way of thinking, in 140 characters, you know, and what would be, you know, what is the top line priority and concern for your organization of providers?
For our organization of providers, it's that we have providers in place to take care of all the individuals who need health care in this country. And, you know, with the new health care reforms going into place, that whole thing is sort of a sea of change that everybody has to adapt to. And we think we're adapting pretty well as nurse practitioners, but our goal is to get our patients the care that they need through giving them that care,
right,
whatever that takes.
Sure, sure. Patricia, thank you so much for coming all this way.
Thank you
and
so much.
And we really value the work that you all do, and we're so glad that you're here. And I know we're going to get to know each other better after this, so thanks so much.
Take care.